Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Good morning.
Good morning.
Okay.
A minute or two before we get started. Some people had questions about whether or not you could take the flu shot at the same time as you got your booster, or additional COVID vaccination, and the information is you can get them at the same time or separately. So, and a good time to get the flu shot is anytime after October. Some people are getting it in September. There's nothing wrong with that. But I would recommend October.
Yeah, I got mine the first week of September last year, when as soon as it was offered.
Mm-hmm.
And I didn't get the flu, so I don't know.
Okay.
But I think we're going to be able to get the booster in September, I think, right?
Yeah, late September, right.
Okay.
But we should still wait 8 months after the last vaccine, after the vaccine's completed.
No, I think a minimum of 6 months.
Okay.
And of course, there's some data that says 5 months, but 6 months is reasonable. And if you want, you can get both shots at the same time. The flu shot and the COVID.
So Janice, we have the same color shirt on.
Hey, how about that? Thinking alike.
Yeah. Great minds think alike. Right?
That's right.
Perfect.
I've got to leave promptly at 10 because I have to go to a funeral. So.
Oh yeah, my stepbrother died. I think on Sunday. He had a blood clot in his leg, and he didn't go to the doctor, and it broke off. And
why did he not go to the doctor? Just
he said he was covered by the blood of Jesus. That's what he told me. And I talked to him about getting a vaccination. He said he was not going to do that because he was covered.
I see.
Yeah. Sister and brother told him the same thing. He told them the same thing.
What's his name? David Cohen?
No. Now David passed away. The David that came to our group. He had multiple things wrong with it. He had Crohn's disease, in addition to a bunch of other things were happening. He had a heart attack a couple years ago.
I thought his last name was Sullivan.
No. Kevin Sullivan is still here.
Okay.
Is he a musician?
David came to our group twice.
Oh.
When we were in person. Yeah, he passed away.
Now, but was he a musician?
David, no.
Oh, okay.
And my stepbrother, no. So
did David get a transplant?
David had a transplant probably 20 years ago.
I see.
Or more. Yeah, he had a liver.
Oh.
Yeah, he had liver cancer.
Oh my gosh.
Welcome back,
Oh,
Mariah.
praise the
Good to see
Lord.
you.
It's
Welcome
so
back.
nice seeing everybody. Good morning.
Good
I went to,
morning.
I went to Tuesday to the hospital to administer to my dialysis patients so I can make to this meeting this morning. So my supervisor, Reverend Dickerson, said, yeah, okay, because I'm supposed to be there Thursday morning, but I wanted to be here. Dr. Callender, and most of you know Miss Rao, the dietitian. Most of you know her, right?
Yes,
Yes.
yes,
Rao, the dietitian.
Yes.
yes.
Her husband died of coronavirus.
Oh, no.
Yeah.
Mhm.
He died in June. I know most of you know because she used to speak in our groups. Remember in the
Yeah.
hospital?
Oh, yeah.
Yes, I remember
Miss
her
Rao, right.
Yeah.
very well.
Yeah. And she says she doesn't tell to anybody. He died last year. But she told me because I asked her, how is her husband doing? And I'm a people's person, she said, but she tries to keep that to herself, I told her, I know how you, I understand what you're saying, but sometimes it'll help just to talk to somebody that you trust, to
Mhm.
cope with it. It's somebody that you trust, that So she said, okay, I'll do that because she's been keeping it. She's not sharing it with anybody, any co-workers, anybody in the hospital. It's been almost a year he died. And she said, I was the second person that that she has told this to. So she needs to speak about it to somebody that she trusts. I told her.
Mhm.
Very sad, very sad. Young man.
Yeah. So many, what is it? Over 640,000 Americans?
Oh my gosh.
Yeah.
Oh,
Well, let me ask you, did he have the shots?
That was before the shots.
This is before the shots, right? He
Right.
died last year in June. When
Yeah, the shots didn't come out till December.
Right. He died before the shots, right. And they won't even allow her, she said. He died right here at Adventist Hospital in Silver Spring. And for 3 weeks, he was in the hospital. They could not go. Only time few members were allowed during the funeral from far, because at that time it was very dangerous. And she kept all this in her mind and heart all this time for more than a year and a half. I said, I told her it's not good for her health. I can, sympathize with her feelings, but somebody that she trusts a lot, she said, the only reason I told you is because you asked me about him and you're a people's person. That's what she told me, So I gave her a little, she needs to have somebody, to talk to about it. She's suffering inside.
Mm.
She's really
Well, you're
suffering.
the right person because
Well, I just saw her in passing only for 2 minutes, and that was it. End of the story. So,
and you're an expert on grieving.
but we don't see. I'm just a chaplain. It's just in passing. I saw it in the cafeteria, and that was it. And every time I see her afterwards, it's in passing. So I really can't. It's nothing that I can do for her. Because it's in passing only we see each other. Howard has got 400-500 people, patients, doctors, nurses. We all are going, workers. So so she has not said anything about talking to anybody or anything, but I encouraged her.
John Buchanan, you can start stuff.
All righty.
The impact of coronavirus on the mental health of the world as well as the United States is incalculable.
Oh my gosh. Oh, 2 teachers died. My God.
That was fast, John. Anyway, it is good news that both of them, Jesse Jackson was discharged from the hospital rehab center, and his wife is now out of the ICU. She wasn't vaccinated because she has pre-existing conditions, whatever they are.
I had a friend who was in Chicago the week before this was announced, And she was in a hotel with Jesse Jackson,
Oh,
spoke to him, held his hand. He was
yeah.
very frail, but he has Parkinson's, I think it is.
Right.
Yes, yes,
But she said he was very pleasant.
he is very nice, very nice. And as a matter of fact, Dr. Callender, his wife was coming to Harvard for the treatment, Howard University Hospital. He told me what it was, but I forgot, 2 years ago that was. Yeah.
I had a question about that, Doc. One of my students from when I was teaching at Kelly Miller at junior high, she's an adult, she's 50, 52, I think. She didn't want to take the vaccine because she was a cancer survivor,
Oh,
and so she's immunocompromised.
That's not a reason not to take the vaccine.
yeah.
I tried to explain to her that, but I was just wondering, the people that decline from getting the vaccination who say that they have medical reasons, what can we say to them? It's better to go ahead and get it done.
Well, to find out what are the medical reasons. Being a cancer survivor means you need not only the vaccination, but you need a booster shot.
Right.
I have a friend who was totally against it, didn't want to do it. She has an older husband, made sure he got it. And no, I can't do it. I'm not ready. I don't think it's right. And she and I were at a celebration together, and the topic of conversation was COVID vaccine. And someone said, well, anyone who doesn't get it, they're just stupid, they're ignorant. And the next day she told me about it because it was a relative of mine. And I told her, you have to realize you're the minority. Everyone else is getting vaccinated. Everyone I know, I'm not going to be in a group if I feel that they're not vaccinated.
Right.
And I had something here, small group, which she normally would have been invited. I chose not to because people are very concerned about that.
Yeah. Yeah.
She went this week and got her vaccine.
Oh, praise God.
So I'm glad. It's taken a year, but she did it.
Good. That's
So
good.
I was pleased
Good
with that.
Good news.
What, Dr. Callender, what pre-existing condition did Mrs. Jackson have, Jesse Jackson's wife have, so she couldn't get the vaccine?
They didn't say.
So is there any pre-existing condition that tells you not to take the vaccine?
Well, I don't know. The only pre-existing condition is if you're allergic to vaccines. You've demonstrated allergies to vaccines. And if you have some coagulation issues, some people think that may be a condition, but I don't know of others.
Dr.
But
Callender,
they didn't say which ones.
Dr. Callender, when I got mine, Mrs. Linda, they had on the sheet, are you sensitive or allergic to certain things? And one of the things they pulled up was the Guillain-Barré syndrome.
Right.
And also an ingredient in the mRNA inoculation, some ingredient there. And they said some of that stuff, or even seizure disorders, they put that on the sheet. And then they said, ask your doctor or don't take this shot.
Right. Okay. Yeah, anything that is that you have demonstrated some allergy to when you're vaccinated is a condition. But the ones you mentioned make sense. But I don't know. Very often they say pre-existing conditions and they don't say what they are, so you can only guess. Now, Arthur is somebody that greets all of us as we age, whether we like Arthur or not. And so there's some things that predisposed to Arthur, and there's some things that aren't. There are not too many people who are over 60 who haven't dealt with arthritis. So it's very common. And, we talk about dietary diets that associated with less author, but it's pretty tough to do without bleeding off after you reach the age of 60.
Dr. Callender, quick question. I know it means it's pain, but what is it actually? What is arthritis?
Inflammation of the joints.
How does that happen? What does that?
Age.
Age?
Well, you know, if you have athletes, for example, because they do a lot of jumping up and down, and their joints are more likely to have inflammation, and the inflammation then manifests itself with joint pain, whether it's the knee or the wrist or the foot. And so often the first thing I did when I got mine was to exercise. And that helped a lot. Weight loss, of course, helps as well. But in terms of what it is this inflammation that as a consequence of stressing your joints, whether it's by walking around or jumping up and down or whatever. And since all of us have been active all of our lives, it's not clear which joint is going to be the joint for you that demonstrates your aging.
I know several months ago, I was having an issue with my arm and hand, very painful. And my sister said, girl, I know what that is. That's arthritis. I said, no, I'm gonna go to the doctor. And of course it was arthritis, but he sent me to therapy. He recommended 4 sessions. And when I went to the therapist, they signed me up for 12. And I said, yeah, they're trying to get my money. I'm telling you, it helped.
Yeah.
I was very limited. I couldn't extend my arm. It was painful. I don't have the pain. I can stretch, I can reach. I think the key is not to ignore it. If you can do something about it, I mean, exercise, whatever joint it might be, it's helpful to keep it from getting worse.
Well spoken. And I believe that I think this started about 20 years ago. And since then, it's been minimal. It comes and goes every now and then, but it's nothing like when I first started, I could hardly kneel down to pray. But after the exercise and everything else, it's minuscule. So for some people, it requires weight loss because they put so much weight on the joint.
That's right.
Especially if it's the knee and the ankle.
That's right.
Yeah. So.
Dr. Callender, you're so right, because my orthopedic doctor told me the same thing. I was having problems like Janet, I'm so much of pain in my knees and my hands and everything. And this is all because of my, COVID weight gain, He said, you're going to be in a wheelchair pretty soon if you don't lose at least 25 to 30 pounds within this year, he said, And I started that when he told me that, started on physical therapy. He said, weight puts that pressure on your knees. If you take off all that weight, your knees will feel so much better. You'll be able to move better.
Dr. Callender, what about like when they say take a cortisone shot and things like that for inflammation?
Well, I think it depends how bad it is. If it's real bad and you can't stand the pain, that's an anti-inflammatory drug, which is very effective, especially for bursitis, things like that. So as a temporary thing, of course, steroids have their own side effects, but with the injection of one time, it's not associated with many side effects. But it is a temporary reliever of arthritic pain. Now it's interesting as we look at these superfoods, salmon seems to be number one. And we see number 2 is olive oil
Yeah.
and good old cherries, sweet cherries. That's interesting. I didn't know cherries was good for arthritis. And then garlic, those of you who like garlic.
I love it. Yeah.
And then
Oh, yeah.
spinach, good old spinach and kale, which very
Oh,
good. So those are some of the foods that they
spinach and kale.
recommend for dealing with arthritis.
Dr.
Anybody? You're going.
Last night I cooked salmon in olive oil and I had spinach as a side. I feel no pain today.
Oh, good.
Dr. Callender, I heard that cherries are also good for what they term gouty arthritis.
Oh,
Well, I think gouty arthritis is so painful that you need more than cherries.
Life is not a bowl of cherries.
You need a cure.
Yeah, I think the pain of gout is comparable to the pain of I'm told, of delivering babies and kidney stones.
oh my goodness.
Dr. Counter, one other thing about the fish oil though. So I take a capsule of fish oil twice a day anyway, but I heard they said the fish oil is good for you, but not in a pill form. So I was wondering if you knew anything about why they
I
don't
do
recommend.
not know. I hadn't heard that it was not good in the pill form. So
Mhm.
I don't know. Darryl, you got any ideas on that?
No.
Okay. Okay. We're in the superfood mode, so it's lowering blood pressure and anti-inflammatory and decreasing strokes, of course, are important. And these are some foods. Beets, we talked about that before. Now, you a beets man?
No. Beets, spinach, they're all hybrid, so I avoid them.
One thing, you're consistent. You avoid hybrids.
I'm seeing a lot of commercials on TV for beet juice. They've come up.
Yeah.
Well,
I
beets
do.
is well known to be very effective, and they
Yeah.
recommend it highly
Yeah.
as and because of its antioxidant properties.
Yeah.
Maybe that's why the Russians would drink or take the borscht soup, the beet soup, hot soup.
Oh,
Yeah, it's highly regarded. Now, I didn't know about pumpkin seeds. Walnuts I knew about. Now, you aware of the pumpkin seeds value?
Yeah, very beneficial. A lot of the foods in the gourd family are very good for you.
Nuts we've talked about before. Tofu is something that people who don't eat meat, because it's a great source of plant protein.
Yeah.
And a substitute for red meat.
But it's a soybean product, another hybrid, and it can interfere with the digestion with quite a few people.
Oh.
Back to the olive oils. So I don't know why they said of course, most people do get the oil in their diets by another means. I didn't, but I know of no reason why a pill with olive oil wouldn't help.
Yeah. Caution with olive oil is frying it in high heat.
Yeah.
Yeah, should avoid that. Like medium, low heat, saute. That's type of thing is good, but high heat, the olive oil breaks down.
What about garbanzo beans?
Oh,
I
they're
know beans.
good. They're
Also
good.
known as chickpeas, very good. Excellent.
Oh, that's what
Love them.
oh, okay. When you say the garbanzo, I didn't know if that was, okay. So chickpea, same thing, okay.
They make hummus out of that, right?
Yes.
Yeah, that's right. Yeah, how much? Yeah. Oatmeal,
Yeah, I
it's
like
highly
it.
touted. How many of you like oatmeal?
I do.
I had it for breakfast
It's
this
the
I
morning.
test.
love oatmeal.
Oats are another hybrid.
Balanced hybrids. Uh,
Man-made hybrid, not a natural hybrid like an apple. All apples are good. All oats are bad. All spinach bad. Beets bad.
Spinach? Oh,
Like,
well, what?
Well, there's a lot of data that disagrees with you, but anyway. Um, because all hybrids are not bad.
no,
Most people think.
those are wonderful. Man, we can't get it right.
Okay. Blueberries, and they talked about blueberries, of course, which we've talked long about how good berries are. So we've read many articles that talk about the berries. Broccoli and Brussels sprouts.
Oh, I love them.
Broccoli and cauliflower hybrids.
Oh, no.
You can't take me anywhere.
What about chili peppers?
Oh, I love them too. They're
Yes.
good.
Yes.
Good.
Finally, something we should eat.
Yeah.
Have
All American people need to eat that. That's very good for your health.
Chili peppers?
Oh, yeah. It's been there for thousands and thousands of years in Asia and Africa. That's all we eat. It's good for your health. And that's why they're so skinny, because they don't eat like American people, they eat butter and all that stuff. It's not good for you. Sugar, no. But that hot pepper chilies are excellent. It will make you skinny, skinny, skinny.
Yeah,
Yeah.
if you can stand it.
Got to get used to it. It's a matter of acclimation.
Hmm. Okay.
This answers the question about fish oil, Darryl.
Sure. Oh, yeah.
That doesn't answer the question about why pill. If it did not reduce their risk of, that's all. It didn't say that it hurt. It said it did not reduce the risk of cardiac events.
Dr. Calendar, why people don't talk about the old-fashioned cod liver oil?
Yeah. That's a good one. Yeah.
That we grew up on. I don't
Right.
know. I haven't seen much about cod liver oil. Darryl, what's your take on cod liver oil?
Well, I'm a vegan, so if it comes from a fish, I ain't down with that.
Okay.
Dr. Callender, I heard John Buchanan say he was taking fish oil supplements, and we just had the article, and we've had one before that's saying that fish oil really doesn't do you any good. So John Buchanan, you remember saying that before. Are you still going to take it?
It didn't say it didn't do any good. It said it did not reduce the cardiac events.
Okay, so what good is fish oil?
Well, fish oil has the omega-3 fatty acids,
Yeah.
which is generally good, thought to be helpful. That's the advantage of fish oil, is that it's thought that the omega fatty acids are helpful. Thought. So that's why people take it. So that's the answer to your question, why they take it.
So wouldn't eating just salmon or something like that, a regular fish, instead of taking a supplement?
Well, I eat salmon anyway. I eat fish
Okay.
every week. Two,
No,
two, 3 times a week.
yeah. I think that there are many things that are known to help. That one may be helpful, maybe not. So the salmon, of course, stands the test of time.
Or even better, just putting olive oil and vinegar on your salad.
Yeah, that's a good one. Good one.
Now, for your brain, we have a lot of rumors and things about what's good for your brain, what's not good for your brain. And so these are some of the things that they're talking about, the good old green vegetables, grains and fish, and low in red meat, it's thought to be good. We all know that, as Darryl and others have mentioned many times, that processed foods and sugar are not good for the brain anyway. So good night's sleep is good, and I think that's where a lot of us fall down. 8 hours is thought to be the gold standard. And I wonder how many of us get 8 hours, 7, 8 hours sleep a night. Are you, Chaplain, are you down to 8 hours now?
Yeah, since the pandemic, it's been kind of crazy. So I still get 7 or 8 hours of sleep every
That's
night.
wonderful. Good, good.
Yeah.
And then, of course, good old exercise is always good
Oh, yeah.
for everybody,
Exercise is so important.
for all organs, including the brain. And
Yeah.
it's interesting how it's also good for depression, which is
Yeah.
increasing with COVID, and social interactions, which is
Yeah.
one of the reasons why going to church is so
Yeah.
helpful. One of the reasons why going to help churches to
That's
help,
right.
along with meditation.
Um,
And then-
Dr. Callender, maybe that's why stress, suicide, and all of that, because of the COVID, and people had to stay isolated and couldn't have that social contact.
Yeah.
Yeah, absolutely. Yeah, and another reason why they missed going to church. Any news when your church is going to open again?
My church is open.
Oh, it is. Okay. All right. Ours, Asbury is opening on the 12th of September, and some churches opening the first week in September. With the Delta, there's still a great concern, but still a great need. And but there's so many of the ministers still aren't vaccinated, and so when you go back to services and you don't have the masks and the other things that you need to have, it's concerning that that will speed up the Delta variant, but we'll see.
Dr. Callender, do you remember when we used to say that everybody needed 8 hugs a day?
I never heard about that.
I never heard about that. No.
Because hugs are not recommended.
No, no, no,
Not now.
no.
Not now, but I'm talking about way
Since
back
COVID.
in the day.
Oh,
Yeah,
okay.
but not
That's
now.
before COVID.
Oh yeah, way before COVID. 8 hugs a day was,
Oh, no.
supposed to be very good for people.
Yeah. Now you
No.
can't even shake hands.
No, I don't want to shake hands. No.
We
No.
did have an article talking about the human touch, human deprivation. Without that human touch, it affects you mentally as well as physically.
Yeah.
And everyone should have some type of touch. Even infants, they had studies about that. Infants,
you got
human touch deprivation, no
Sure.
one touching them. They could not grow physically or mentally. And the same thing with adults. And that's where the hugging came into place. But of course, with COVID, we weren't able to socialize nor touch, but it does affect us mentally as well as physically.
But the people who are married, they got their husband and wife, they hug as much as they want, and their children in your family. Now, it's I see people who are senior citizens living by themselves, don't have anybody, single people. Yeah, they have problems with that. But those who are married, they have their husband and wife, and and children and everything, and those who are pets. So it's a problem. Those who are single and elderly people who are living by themselves. Yeah.
But you're right, very much so. But the thing that you have to be careful about is hugging your grandchildren.
Yes, you do.
Because we heard a couple of reports where
Yeah.
People got COVID from their
Their
grandchild.
grandchildren.
Yeah.
Absolutely.
Mm.
Absolutely. Yes.
Well, you
But at
got
least you have your
nine.
husband and wife, you can hug each other all you want. So that's the benefit of marriage.
My friend Ed Anderson, he caught COVID from his grandson.
Oh my goodness.
He and his wife and his daughter
Oh gosh.
got COVID from the grandson. The grandson was 8 years old.
Was he vaccinated?
The
Okay.
grandson, no, but
No, the adult.
yeah. Ed was vaccinated. He was sick for about 3 days at home.
My, yeah.
This is an interesting article on the health effects of working from home. It's not that we wanted to work at home, but we were forced to work at home.
Yeah.
And this lists some of the positive things that happened as a consequence. And as you look at the list, it's interesting, some of the things that they talk about. One of the interesting things about the survey is that they thought it was positive impact upon their mental health, which is kind of surprising because we know, and well, one of the things is that when you work remotely, you actually interact with people. And you actually, one of the other things is that people who don't do names so well like the remote because
Yeah.
on the screen you have people's names. And so you don't have to remember their names because their names up there. So that's one of the benefits of working at home. The other thing is that working at home, you don't have to go out.
Yeah.
And so sometimes you get spoiled because
Yeah.
if you have to get up to go to work, you have to get up early.
Yeah.
Whereas if you're on Zoom, you just go downstairs and
Yeah.
you don't have to spend a lot of time. So,
You're right.
On Zoom, you never
but
on Zoom
go
you
ahead, Dan.
on Zoom you never have to wear pants.
Yeah.
That's right.
Yeah.
That's right. That's right. Yeah. There's a lot of little benefits of Zoom that you lose when you have to go back to work.
Absolutely.
Yeah. Yeah. But you get spoiled.
Yeah, you do.
Now, this is an interesting article. It's kind of crazy that says that because how you look on Zoom causes people to go to the doctor and more than ever, go to the dermatologist more than ever because they don't like the way they look on Zoom. Not that they don't like the way they look normally, but they don't like the way they look on Zoom. So they call that Zoom dysmorphia. So that's a new
Also, how you place your
disease. Huh? That's a new disease. Interesting. Can you imagine paying attention to how you look on Zoom, man? I don't know. Any of you worry about how you look on Zoom? It never occurred
That's
to
my
you.
tape over mine.
Huh?
I
I
think we
have
all
tape
do.
over my camera.
Well,
I
let's
think we
just say us women, we worry about it,
That's that's correct.
combing our hair and all that. And then I'm trying to figure out, should I put makeup on and all that kind of stuff. And
Use the
that's why a
tape.
lot of times we just put on our, you go on a formal Zoom program, just leave it blank. You don't even show your face.
Yeah, that we have a phone conference for my MOTEP meetings, and some of the women don't want to do Zoom because they don't want to put on makeup and all that stuff. They just
Right.
want to
Right.
talk. So there is a Zoom dysmorphia. It's just in different ways.
And see, you men don't care. You,
Right.
Yeah,
That's right.
yeah. And I
Could
think
care less. Yeah. I mean, it's like looking in the mirror. I mean, so I don't look good. So what?
and I also think this is a good time to go back to the nature, the natural way that God has made you without all that makeup and all that stuff, you know,
Amen.
just simple, the way our great grandparents were in, you know, from thousands of years, just comb your hair, wash your face, no makeup and all that. It's nice, simple life, no stress, and you'll be happy. You'll be happy the way God made you. Be natural and
Yeah.
just keep going. You'll be happy. Very nice.
okay,
Yeah.
then we should not ever look at TV because that's what,
Idea.
when we see TV, that's the way they say we should look as American. And I was telling somebody else about that. They used to have women plucking out their eyebrows. Now they got us filling them in and tattooing them in. So,
Right.
and so they go for one thing for us women to go through torture. They don't have you men going through anything.
Nope.
I know.
Uh-huh. So it's all on us women to look beautiful and young. In America, it's terrible to look old.
It's okay. We're just going to keep up our culture, our Asian and African. We should be proud of where we came from thousands of years ago. And look at me. I don't have makeup and I don't go to hairstyle. I am who I am. And I'm happy. I'm going to be the way God made me. And I'm
Okay.
happy. Yeah. And
Great.
it's simple life. You save money. And it's nice. Simple life is no stress on you at all.
Very true.
Agree with Chaplain Thorpe.
Very
That is true.
Okay, because
However-
I've been brainwashed, but pray for me.
Okay. All right.
As
You got
This
it.
article just talks about the risk of heart inflammation.
Oh,
And we knew that risk was increased slightly, but of course it's increased even much more by COVID. So that when you're thinking about which do you prefer, and most of the inflammation has not been associated with the need for hospitalization. So
Wait, what? Wait, that. Did I just see that if you took the shot, that it will increase heart inflammation? Is that what I
yes,
saw?
that's well known, right? It's
Oh
just
my
that it's
God.
not. Yes, but if you get COVID, it'll kill you. So.
oh my God. I didn't know that.
Oh yeah, it's well known, especially in the younger population.
Yes,
And
it says
my
most
God.
and it also is not associated with a hospitalization or death for the most part. So
it's mostly young.
it's-
We don't have any of them in the group, so we're okay.
But that's not something that's common, is it? I mean, that doesn't
no,
happen
as I
often.
said, it is more common in young people.
Yeah.
So that's why you don't know much about it. And in young people, it's not very severe either. But if you get COVID, it's much worse. So, yeah. But the reason you haven't heard about it is because it occurs in mostly young men. So, next one, please.
Oh, it's
So
like
this is an article that we talked a little bit about last week, but the fact that it decreases hospitalizations and deaths by 80% makes it even more important for us to know about monoclonal antibodies. Remember last week we talked about the fact that it is free and originally was very expensive, but it's now free. And it also, if you've been exposed to COVID, it can prevent you from getting COVID. So that's a good reason to take the monoclonal antibody if you're exposed. And if you're sick with COVID, this is one of the effective treatments. We've come a long way to be able to talk about something that's 80% reduction in death and hospitalization.
Dr. Callender, how available is this treatment?
It's available. You have to go to centers that and ask for it, but it's available. And remember, at first it was so expensive. We didn't talk about it, but now it is given free of charge.
If we're gonna,
And the only complaint was that nobody's using it. That's the most recent complaint, that most people are not taking advantage of it. This is a new variant, but we don't know what the significance of it. So we have to wait until they study it to tell us whether to worry about it or not. So we'll find out. We hope it's not like the Delta variant, but we shall soon see.
you know,
Well, that's one of the disadvantages of having people in the country and the world who are not vaccinated. So you get all kinds of variants. And so that's why you want to get as many people vaccinated as possible.
I have a question. That picture at the beginning when they're showing about South Africa, I thought the majority of South Africans were Black. Are they white?
The majority of South Africans were white.
Oh, okay.
But now, and matter of fact, the group that is associated with the most protest stations now are Indians. And I guess it depends which part of South Africa you're talking about. Because there's certain parts of South Africa that are dominated by white people, and there's certain parts that are dominated by Africans.
Yeah, I was a little confused by that picture too, because South Africa is a Black country. You got this white line.
Oh, but what depends which part of South Africa you're talking about.
Well, Cape Town's a Black.
Yeah.
Well, it must be a white neighborhood.
Yeah, that's Cape Town.
Mhm.
That was Cape Town. That's the one city.
Yeah. Booster shots. There's a lot of talk about who should get booster shots. And there's a lot of discussion about what age you should get them and whether everybody should get them. I think it's clear now that the older population, people over 50 should get them. What is not as clear is whether or not the people under 50 should get it. There's still a lot of discussion about that. And we know the immunosuppressed people need a booster shot. We know the people over 60 need a booster shot. What about those under 40? Still not a whole lot of data on those under 40. Yeah, there's much data on those over 50, but not a whole lot on those under 40.
Dr.
So-
Calder, I have a question about that. Under 50 and over 50, is there, I'm sure there's a way that they can check the efficacy of the two COVID shots that people get. And then that would tell them whether it's a need to get the third one or not.
Well, I think that most of the studies that they've done on people who are over 6 months has demonstrated that the antibody titer is waning. And therefore, that's why they have decided that for many, a third shot is recommended. But there's still a lot of research that can be done. But until that's done, the question is, what is the safer thing to do? And I think if you're over 50, or if you're immunosuppressed, there's no question you should get a booster. If you're under 50, then there's a question of whether or not you want to do it. Because the side effects are relatively minimal, it's up to you. It's up to your choice.
I have a friend who's Rh negative blood type, and she had a severe reaction after the second Pfizer vaccine, facial swelling. And so she's reluctant to get a booster. Is that
Makes sense.
a known side effect for Rh negative people and the COVID vaccines?
I don't know. I don't know the answer to that question because I don't know how many Rh negative people have had that side effect. So I don't know. And the question is, how much swelling did she have? So much so that did it involve only her face, or
One side of the
did it
face,
involve
swelling.
just her face?
Swelling persisted for a couple of weeks.
But it was just her face.
Yes.
Mm. Yeah, I can see why she would be hesitant, and I think that's the kind of person I would want to get antibody tests on to see what my antibody titers were, because I think if you had a severe allergic reaction, then you would want to be sure if you're going to take a test, if you're going to take the booster shot.
You know,
But
Calendar,
yes.
You know, just like the flu shot, the flu vaccine that changes every year, you know, depending on which strain of the flu is going to be predominant. And sometimes they have to guess at it. Looks like we're going to be doing the same, to me, looks like we're going to be doing the same thing with COVID, because which variant is going to be predominant or more powerful. And now it seems with this Pfizer and Moderna are talking about tweaking the structure of that messenger RNA vaccine to deal with the new variants.
Well, we shall see. We shall see. The one thing about it is we'll be able to get the research and find out. You may be right. We have to wait and see. Yeah. And they do talk about the side effects are mild for everybody else except your friend Darryl, who had a reaction to the second dose that was stronger than the first dose. But
is it my understanding that the booster shot is supposed to be just like the first dose?
exactly.
Okay, so I thought about that when Darryl said that the boost, she didn't get sick with the first dose, so maybe it wouldn't affect her.
Well, she got it with the second dose.
Yeah, I said, so maybe getting a booster would be like getting the first shot over.
Yeah.
Or it might not. So I don't know. We don't know.
Dr. Callender, did they approve the third booster shot?
No, they didn't.
Actually, there's no study on. It's the same. It's the same. Nothing's different from the booster shot than the first shot or the second shot. Same dose, same drug, same everything.
But can we get it? I mean, if you want it, you know.
Well, most people, it's probably not going to be available until the middle of September.
Oh, okay. Okay.
And except for the immunosuppressed people who need to get it now.
Dr. Callender, what's the process of getting the booster shot if you're immunosuppressed?
You just go to wherever you got the first shot, go back there.
Okay, you don't have to bring anything
Well,
to show
you
them
need
that
to
you're
bring your record of your first two shots so they can put it down there.
Okay, but nothing to show that you're immunosuppressed. You just tell them you
Just
are.
tell them, yeah, right.
Oh,
yeah.
okay.
Yeah, you just let them know that you are. That's all. Because everybody who's immunosuppressed is recommended to get the third shot.
That's exactly what I did. I went to CVS and signed up for the booster shot. I took my record of my first two, and they just asked me, why I was getting the booster shot, and I told I was immunosuppressed. Plus, I'm over 60.
Dr. Callender, have they decided, or is there now a national database where they can look to see who has or has not gotten vaccinated? Because I think I remember reading yesterday where a young lady had forged her vaccination card instead of MODR
It's MA.
it was MA, Madonna,
Yeah.
Moderna or
Right.
Moderna.
Mad-
Is there a
mad-
national database where they can look in and see who has or has not been vaccinated?
I believe so, but I'm not absolutely positive. But I know in DC and Maryland, there is a database, but I don't know about there being a national database. I know the different regions have a database, and I suspect they may have one, but I'm not sure positive about it.
And also, Dr. Callender, I saw this morning on CNN that this lady was selling fake that cards, and
That's-
more than 300 she sold to nursing home workers, healthcare workers in hospitals, frontline workers. So I was just shocked. Oh my God.
Yeah, whatever you can imagine, people do it.
This,
Yeah,
I
yeah.
just Googled the national database and the CDC says, unfortunately, there is no national organization that maintains vaccination records.
Oh no.
So it's just the states, huh?
Yes.
Just the states.
Wow.
this article about the lady who forged
Mhm.
her card and misspelled it to get into Hawaii.
My
That's
God.
it. That's easy to pick up.
Mhm.
So if I've been vaccinated in Maryland and I travel like this lady went to Hawaii,
Oh yeah, I
if
saw that.
if Moderna was not misspelled, she would have gotten through, correct?
Yeah,
Yeah.
Mhm.
So that's why you never know who is or who is not
Right,
vaccinated.
right. Yeah.
right.
That's why I'm in favor of that passport thing that Montgomery County executive wants to issue. I like that. Good to have that.
Well, I actually am not in favor of that. I'm in favor of having a record of it that allows you to expand it, because one of the limitations of the passport is that it's dated, and so if you need to expand it, I'm not sure how you do it.
Oh, I see.
Whereas
Okay.
if you have a record of it and you
Right,
have your
right.
card, you just check it off and it moves on. But
Yeah, you're right. Yeah, that's true. That's true. Yeah.
and there's still discussion about whether you need to get it at 5 months or 6 months and 7 months or 8 months, and whether you ought to get an antibody test before you get it. And so as time goes on, we'll have better data, but there's still some controversy about who should get the third booster shot.
Dr. Callender, before we move on, if they had stuff for driver's license and stuff like that across states, I don't see why they could not create a database for the
Yeah,
the
that's
shot,
right.
because
Yeah,
anywhere that you drive, if they put your name in or whatever,
that's true.
it's across. So I can't understand why they can create that database at this
Right.
point.
Right.
Right, that's true.
That's a very good point.
And it could if they want to, so they should do it.
My fear, Dr. Callender, is that I'm vaccinated. I am scared to death of these people who are not vaccinated, and I don't know who they are in the church, grocery stores, walking around, or anywhere, restaurants. I mean,
That's why everybody's recommended to wear masks and social
Absolutely.
distance. Because you're right, you don't know who's who.
Mhm.
I don't know.
And that's why if you're over 50, as far as I'm concerned, and certainly over 60, the need for a booster shot is a good idea. But still, the mask and social distancing is thought to be the best protection, as long as you're vaccinated. Well, so we got a population of 300 million people, and only 170 are actually vaccinated. So
Ooh,
we still got a good ways to
that's
go.
horrible.
And some have speculated that with these variants, that we need to have 80 to 90% in order to get the so-called herd immunity.
Dr. Callender, go ahead.
Go ahead, honey.
I would just wanted to know whether Dr. Jeter was on the call.
No, he's on next.
Okay. All right. And we welcome Joyce Brown. She's on today.
Oh,
Wow, how
hi,
about that?
Joyce.
Cutie on duty, huh?
Yep.
Well, that's great. That's nice to have
Yeah,
Joyce.
Dr. Callender, what I was going to ask you was these thousands and thousands of Afghan people have come here now to Virginia based Dallas airport. I mean, no vaccination, the mask, I don't know. How do you?
They gave them the vaccination upon entry.
Oh, I see.
They vaccinated them rascals upon entry. Okay.
The Afghan people, they gave them vaccination?
Oh, yes, they did.
Oh, that's nice. Very nice. Yeah.
Okay. I'm gonna have to leave, so.
Me too. Okay.
Yeah. I've got to go to a funeral, so.
Yeah.
So
I guess we'll see you next week then.
yes, see you next week.
Very good session. Thank you, Dr. Callender.
Thank you.
Alrighty,
Thank
you.
you, everybody.
Oh,
Bye-bye.
it's over already? Wow, what? I must have missed it.
What'd you miss, Pearline?
I missed the meeting. I was busy.
Oh, well, I'm proud of you trying to work and listen at the same time.
Yeah. Yeah, they will.
You working
All right,
hard,
take care,
Darryl.
y'all. Take care, y'all.
Okay, got to go back to work.
Bye.